Today I'm going to be talking about the treatment of panic disorder and how we go about teaching someone how to control and manage panic attacks. Hi everyone. In today's video I'm going to be talking about panic disorder and cognitive behavioral therapy for panic disorder, the various different components of treatment that we go about when we are teaching someone how to overcome panic attacks. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's talk about cognitive behavioral therapy for panic disorder. Now, CBT works really well for a lot of conditions, a lot of anxiety disorders, the treatment of depression, but panic disorder is one of those conditions that cognitive behavioral therapy is by far and away the most effective treatment. And so what I'm going to be talking about today is the main components of treatment for panic and how we go about teaching someone to better understand and better manage their panic attacks. Now, the first thing to know about managing and treating panic disorder is you have to understand what's happening in a panic attack. And you have to understand the factors that maintain panic attacks and panic disorder. And I've done a couple of videos already describing those, describing the fear of fear model of panic and the two components that maintain panic attacks and panic disorder. And so if you haven't seen those videos, what I'd suggest is you stop watching this video and go and watch those videos. I'll leave links to those videos in the description below, and I'll also leave a link up here somewhere. So watch those videos because the treatment components come directly from the model and understanding of what happens in a panic attack. And if you don't know that, these treatment components aren't going to make a whole lot of sense. So the key is to understand the fear of fear model of panic, and that panic attacks aren't caused by physical sensations of anxiety that a person experiences during a panic attack, but that panic attacks are caused by a catastrophic misinterpretation of those physical sensations. So we think about the panic sensations in catastrophic ways, in ways that make me more anxious about the physical sensations. And the two factors that maintain panic attacks and panic disorder is avoidance. So avoiding or trying to avoid the physical sensations of anxiety and the physical sensations that a person will experience in panic disorder, but also avoidance of situations or places or activities that may bring up those physical sensations. So there's this general avoidance of doing things that may, for example, get my heart rate increased, or get me breathing more quickly, or get me feeling sort of hot and sort of stuffy. So I'll try to avoid anything that may bring on the physical sensations of panic. And the two factors, and the other factor that maintains panic disorder is this anxious apprehension, or this fear of when the next panic attack might occur. So I'm constantly living in this kind of fear, or this nervousness or tension about when I might have another panic attack. So that's the model, and those are the factors that maintain panic. So the first treatment component that we talk about when we work on panic disorder is relaxation training. Now, there's lots of different forms of relaxation training. So there's things like diaphragmatic breathing, there's things like box breathing or progressive muscle relaxation, autogenic training, visualization. There's lots of things that you can do in terms of relaxation training. And if you just Google relaxation training or do a YouTube search on relaxation training, you'll find lots of really good videos about relaxation. Now, the key is to understand when to use relaxation training to prevent a panic attack, and why you use relaxation to manage panic attacks in panic disorder. The key is do not, and I will repeat this, do not use relaxation techniques to try and prevent a panic attack from occurring. So this is one of the biggest mistakes that I see people will engage in, is they start to feel a panic attack coming on and they'll try and calm themselves down. They'll try and use deep breathing techniques, or they'll try and relax themselves. This is a big mistake, and I'll explain why probably in another video, because it's really important that you don't use these relaxation skills or relaxation tools to ward off a panic attack if you feel a panic attack coming on. So you might be wondering, okay, well, if I'm not supposed to use these relaxation tools and relaxation techniques to try and prevent a panic attack from coming on, when am I supposed to use them, or how am I supposed to use them? Well, the idea is to sort of imagine that this is the threshold that you need to hit to experience a panic attack. And because of that anxious apprehension, your level of tension and stress is right here. Well, it doesn't take a lot of sort of stress or tension or pressure for you to bump up there and hit that threshold. And so if you're always here because you're kind of anxious or stressed about potentially having another panic attack, then you're really close to that threshold, and it doesn't take much to hit that threshold and to cause you to have to start or enter into a panic attack. So the idea of relaxation training isn't to change the threshold, but the idea of relaxation training is to bring down your overall level of stress and tension. And so now, because you've been regularly practicing relaxation training, it takes a lot more and a lot more stress to hit that threshold. So that's how you use relaxation skills. It's not to prevent a panic attack from coming on when you feel yourself starting to feel panicky or anxious, but it's to bring down that overall level of stress and tension so that it takes more to hit that panic threshold. So that's really important. And again, I'll emphasize, do not use these relaxation skills to try and ward off or prevent a panic attack. Use them at times when you're not experiencing panic or anxiety, just as a way of bringing down your overall level of stress and tension. The second component of treatment is exposure. Now, exposure in panic disorder can take a couple of different forms. Now, one of them is really counterintuitive, and for a lot of my clients tends to be the scariest thing when we talk about how you manage panic attacks. And this is something called interoceptive exposure. And what interoceptive exposure is, it's intentionally bringing on the physical sensations that you fear in a panic attack. So when I'm working with clients, we'll do things like intentionally hyperventilate to bring on those physical sensations that come when you hyperventilate. So lightheadedness, hot and sweaty, heart racing, feelings of nausea. We'll get people who, if one of the panic sensations they fear is dizziness, I'll get them to sit in a chair and we'll spin the chair around and around and around to bring on that sensation of dizziness. If the feared sensations are my heart racing, well, what we'll do is we'll run on the spot really quickly for 30 seconds or a minute, or run up and down stairs for 30 seconds or a minute, and then stop suddenly, and then get a person to notice how hard their heart is beating. For people who fear that sensation of choking, we'll get ties, and we'll actually tie around your neck and tighten it up so that it does feel a little bit harder to breathe. We'll do things like straw breathing. So there's lots of different things that we can do that mimic or bring on the physical sensations that a person will experience in a panic attack. And so the question you might be asking is, why in the world would we do this? Well, why in the world, if I'm afraid of my heart beating quickly, if I'm afraid of feeling dizzy or nauseous, if I'm afraid of that sensation of my throat being tight or not being able to get enough air, why in the world would I do anything that would bring on these physical sensations? Well, that's the answer. It's because you're afraid of these physical sensations. We want to do exposure to those physical sensations, essentially breaking the link between the physical sensations and those uh-oh thoughts that I talk about in the fear of fear model. So by bringing on these physical sensations over and over and over again, what happens is you become more familiar and more used to those physical sensations outside of the context of a panic attack. So the idea is, you know where these physical sensations are coming from. You know you've brought them on yourself, so you don't experience those uh-oh thoughts when you have these physical sensations. And the more you can have these physical sensations without the uh-oh thoughts, the less scary they become. And so what you do is you break this link between the physical sensations you experience in a panic attack and the uh-oh thoughts that actually cause a person to experience a panic attack. And so the physical sensations become very familiar. And so you practice regularly hyperventilating or breathing through a straw. And then what happens in your day-to-day life, when you start to feel some of those physical sensations come on, the first thought isn't, uh-oh. The first thought is, oh, this is familiar. This feels a lot like what it was like when I did my hyperventilation practice at home. So the physical sensations lose some of their scariness, and you don't immediately jump to those uh-oh thoughts. Now, another form that exposure can take is exposure to those situations or places or activities that a person will avoid because they fear bringing on the physical sensations of anxiety. So I'll get people to do homework such as going to the gym and working out. I'll get people to intentionally drink a cup of coffee if they've avoided drinking coffee because they're afraid that the coffee makes them feel panicky or anxious. What we'll do is we'll get a person to drink coffee to bring on those physical sensations. One of the things people will do is they'll avoid things that might get their heart rate going or get themselves kind of really excited. And so sometimes what can happen is people will avoid sex. And so one of the more fun homework exercises I get to assign people is, go home and have sex and bring on those physical sensations and tolerate them without jumping to those uh-oh thoughts. So what this exposure does is it really begins to sort of open up a person's world and allows them to get back to doing activities and going places that they've been avoiding because they were fearful of bringing on the physical sensations. But because you've already done the interoceptive exposure where you've gotten used to the physical sensations, those physical sensations coming on when you go to the gym aren't as scary anymore because you've broken that link and that connection between the physical sensations and the uh-oh thoughts. And the third component of treatment, cognitive behavioral therapy for panic disorder, is cognitive therapy techniques to actually challenge those uh-oh thoughts. To actually look at the uh-oh thoughts that you might be experiencing that's causing these panic attacks, and to evaluate whether or not these uh-oh thoughts are real, are accurate, are realistic. So challenging the thoughts and learning ways to talk back to the thoughts when you start to feel them coming on, or when you start to have some of these thoughts at the beginning of a panic attack. So challenging thoughts like, if my heart's racing, I'm having a heart attack, or I'm going to die. Or if I start to feel lightheaded or dizzy, I'm going to pass out in this situation. Or other people are going to notice if I'm having a panic attack, and it's going to be really embarrassing. So this third component of treatment is really targeting the uh-oh thoughts and really sort of getting at those scary thoughts that people will have during a panic attack that really drives the panic attack. And so if you can learn ways of challenging those scary thoughts and changing the way you think about the physical sensations and the meaning of the physical sensations, you're not going to experience the anxiety, you're not going to hurry up and tense up, the physical sensations aren't going to increase, and you don't enter that fear of fear cycle. So if you think about our fear of fear model of panic, these various treatment components, these three treatment components, are attacking different parts of this model. So the relaxation training is really getting at that anxious apprehension and reducing the overall levels of anxiety and stress that you might be experiencing, which means you're not as close to that threshold for the sensations to increase to trigger a panic attack. The exposure exercises, both the interoceptive exposure and the natural real-world exposure, what that does is it breaks that link between the physical sensations that you experience during a panic attack and the uh-oh thoughts. And the cognitive therapy or cognitive restructuring really targets those uh-oh thoughts and helps you think about these physical sensations in a different way, in a less scary way, so that you don't fuel this fear of fear cycle with the way that you're thinking. And so the thoughts become less catastrophic and you don't enter that fear of fear model. So all three of these treatment components work together to help cut off the fuel supply of this fear of fear model and panic attacks and help a person overcome and manage their panic disorder. But the key first component is understanding that model. And so that's why I really spend a lot of time emphasizing and explaining the model of panic and the factors that maintain panic disorder. So I hope that's been helpful to give you a sense of how we go about treating panic disorder. I'll be doing some other videos specifically about talking about ways of challenging catastrophic thoughts and overestimating thoughts in panic disorder. So I'll be doing a video about that in the future. So keep an eye out for that. I'd love to hear your comments or thoughts about anything I've talked about in this video, so please leave me some comments in the comments section down below. I hope you're enjoying my videos. If so, and if you want to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's it for today's video. Thank you for making it all the way to the end of this video, and I will see you in the next one.